paranasal sinuses are openings within the skull. Paranasal sinuses are going to help lighten the skull and are filled with mucosa. There are sinuses located in the maxillary bone, ethmoid bone, sphenoid bone, and frontal bone. Fontanelles are large, fibrous areas between the cranial bones in a fetal skull. Their function is to distort the skull for delivery of the fetus and allows for brain growth to continue after birth. There are several fontanelles. See section 9.4 in the text for more images. The fontanelles include two sphenoid fontanelles, two mastoid fontanelles, an anterior fontanelle, which is the largest of the fontanelles, and lastly, the posterior fontanelle. The hyoid bone is in the neck. It's a horseshoe-shaped bone located between the mandible and the larynx. It helps to support the tongue and serves as an attachment site for muscles of the throat. The vertebral column consists of 26 vertebrae. They are grouped into regions. The cervical region is in the neck. The thoracic region is related to the thoracic cavity. The lumbar region is the lower back. The sacrum represents 5 fused vertebrae, and lastly, the coccyx is 3 to 5 fused vertebrae. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The sacrum is considered one single bone in the adult skeleton. The coccyx is also a fused bone in the adult skeleton. The fusion of the sacrum and coccyx is not complete until about ages 25 to 30 years old. The vertebral column is curved. When viewed laterally, it has an S shape. This shape allows the body to maintain balance while standing upright. There are 4 curves associated with the spinal column. While looking at the vertebral column from anatomical position, when it curves posteriorly, it is considered concave, and when it curves anteriorly, it is considered convex. So concave and convex represent the shape of the curve. There are 4 regions of the curve: the cervical, thoracic, lumbar, and sacral. The cervical and lumbar curves are convex because they curve anteriorly. The thoracic and sacral curves are concave because they curve posteriorly. Normally, when an infant is born, its spine looks like the letter C because the thoracic and sacral curves are prominent. These are considered the primary curvatures of the spine. After a few months, when the infant can hold its head up, that means the cervical curve has developed and the lumbar curve will develop, allowing for standing and walking a little later on. These are considered secondary curvatures because they develop after birth. They are also known as compensation curves because these will support the weight of the head while holding the head up and the weight of the body when standing or walking. There are 3 abnormal spinal curvatures: kyphosis, lordosis, and scoliosis. Scoliosis is an abnormal lateral curvature of the spine. Kyphosis is an exaggeration of the thoracic curve, and lordosis is an exaggeration of a lumbar curve. Scoliosis is usually a developmental issue, but could happen due to damage to the vertebrae or muscle paralysis that may only affect one side of the body. Exaggerations of the lumbar curve or lordosis can happen during pregnancy, or if there's excessive abdominal obesity or the abdominal walls are weakened. Kyphosis, or exaggeration of the thoracic curve, is often associated with osteoporosis as the bones of the vertebral column weaken. Kyphosis can also be due to abnormal development of the vertebrae. Let's start looking at the vertebrae themselves. We're going to start by looking at typical features of the vertebrae, and then we'll move on to look at specific vertebrae. The body of the vertebrae is the anterior portion and disc-shaped. It bears the weight of the stacked vertebrae and the body itself. The vertebral arch is formed by the pedicules and the lamina. There are 7 processes of the vertebral arch. The first is the transverse process. These are the processes that point laterally or off to the side. The spinous process is a pointed process on the posterior side. The superior articular process is on the superior surface, and the inferior articular process is on the inferior surface. These processes articulate together to stack the vertebrae. When you stack vertebrae together, the inferior articular process of one vertebrae will articulate with the superior articular process of the vertebrae underneath it. The hole in the vertebrae is known as the vertebral foramen. When the vertebrae are stacked, these holes line up to form the vertebral canal and contain the spinal cord. When the vertebrae are stacked together, an intervertebral foramen also appears. This foramen is a hole that forms between each stacked vertebrae. The spinal nerves that exit the spinal cord will pass through this hole. In between the vertebral bodies is a pad of fibrocartilage that acts as a shock absorber.